Hello and welcome to Old Lang Schmooze, the Edinburgh Jewish Cultural Center podcast. I'm Ella, and today I'm going to tell you about the Herzfeld Prize. The Herzfeld Prize is presented biennially to a living, outstanding Jewish woman from any country who has excelled in surgery, medicine, public health, or the sciences as related to these fields, and whose life and career emulates the lifetime values and success of Dr. Gertrude Herzfeld. This event is put on by the Edinburgh Jewish Cultural Center and the Royal College of Surgeons of Edinburgh, and this year's event chair was Hannah Handelman. Here's Hannah telling us a little bit more about this special event.
People from all around the world could submit nominations based on the Jewish values and career aspirations and career successes of the people that they nominated. And then it is presented in March to coincide with International Women's Day.
So where did this event get its name? Who was Dr. Gertrude Herzfeld?
So Dr. Herzfeld was the first practicing woman surgeon in Scotland and a trailblazer for future generations of female medical students. She was the daughter of Jewish immigrants from Austria. After moving to Edinburgh to study, she qualified from the Edinburgh Medical School in 1914, just 22 years after women were formally admitted to the University of Edinburgh for the very first time.
And this year's winner of the Herzfeld Prize was Dr. Mardge Cohen. She was honored for her work with women and children affected by HIV in the US and Rwanda. Now we'll hear from Dr. Mardge Cohen's own words at the Herzfeld Prize ceremony of 2024, the career milestones and events that ultimately led up to her winning this prestigious prize.
So I grew up in New York City in a home with Jewish parents. My grandparents had immigrated to the U.S. from Eastern Europe in the early 1910s. My brother and I were inculcated with Jewish values of caring about family, of caring about others who were less fortunate, fighting against inequities, making the world better, and if you could, becoming a doctor. Well, I practiced general medicine at Cook County Hospital, which is a very large, public, under-resourced hospital. I worked there for 31 years with my husband, and we learned an enormous amount there. In 1987, a patient named Ida Greathouse knocked very loudly on my clinic door. She felt that her needs as a woman with HIV, as a mother of children, were not being addressed. So I took Ida's admonitions to heart, and with a group of other women health workers, we started the Cook County Hospital Women and Children's Program. We soon found ourselves caring for 2/3 of the women in the Chicago area and their children with HIV, and more than 1,500 patients. We saw women challenged by poverty, racism, violence. They changed their behavior and fought to stay alive, to take their medications, to reunite with their children, to build strong families. By 1994, using the first antiretroviral to treat HIV, we reduced the rate of perinatal HIV transmission from 25% to close to 5%, and our team was then able to reduce the rate to almost zero.
Apart from her incredible work founding one of the country's first women's HIV clinics at Cook County Hospital in Chicago, Dr. Mardge Cohen also played a pivotal role in facilitating care for women who were infected with HIV following the Rwandan genocide of 1994.
In 2004, about 10 years after the Rwanda genocide, and 250,000 women were raped, many deliberately infected with HIV. Leaders of various Rwandan women's associations put out an international SOS, a call to help Rwandan women who were dying of AIDS. The men in jail were receiving medications for their HIV infection, but not one single woman that we were seeing or had been raped by them were getting any medication. I went to Kigali with a small group of women and physicians and advocates to talk with the women from these associations. And over the last 20 years, we worked to build a comprehensive clinical program for 2,500 people, men and women and children, to provide medications for HIV. And remarkably, over 90% of the patients seen in our clinic this year were undetectable, and they basically have the potential to live as long as anybody without HIV.
As part of her work in Rwanda, Dr. Cohen co-founded Women's Equity and Access to Care and Treatment, or We Act X. Dr. Cohen has also co-led an NICHD research study to improve adherence to antiretroviral therapy of 14 to 21-year-olds with HIV in Kigali. Now, Dr. Cohen will talk about her work at the Boston Healthcare for the Homeless program.
I moved from Chicago to Boston in 2007, and I was privileged to start working at Boston Healthcare for the Homeless program. Most importantly for my work there over the last 15 years is I've learned how important it is to acknowledge the existence and hear what people without housing are saying and want. So partnerships in caring and actively challenging inequitable systems and structures will bring us all to the best I think we can be.
It's really amazing to hear Dr. Cohen speak about her career and her achievements, and as a Jewish woman in science myself, I feel really inspired by her. Mardge and her husband Gordy Schiff are family friends of mine. I first met Dr. Cohen when I was going on visits to different universities in the States before I chose Edinburgh University, and I remember walking away from meeting her and just telling my dad that she is everything I want to be in life. But I just knew from then she was such a force to be reckoned with, and it's been really special to honor her this year with this prize. And Hannah, I know that as the chair of this year's event, you met Dr. Mardge Cohen, is that right?
Yes, I did.
What was it like meeting her?
You can read so much about a person and about how much they contributed to their field and already think that they're incredible, but to meet someone like that in person, she really embodied the values of her work, and she made it really apparent that she cared about her patients as much as they cared about her.
This is such a meaningful project and an important one as well. What did it mean to you to be a part of this?
To see the number of lives that Mardge was able to touch in just a couple of days that she was here, and the amount of lives she's touched over the course of her career made every bit of effort that we put into making the prize happen worth it. Really just a lot of hard work and effort from myself and the rest of the Herzfeld Prize committee, especially Professor Joe Goldblatt, who made immense contributions.
So imagine that you've nominated someone for the next biennial Herzfeld Prize. What can they expect?
We fly the winner in, and it was a long weekend of traveling around Edinburgh doing the touristy things, but there was a dinner that involves meeting members of the Royal College of Surgeons of Edinburgh's board. Really a celebration of Jewish joy.
And when can we expect the next round of nominations to open up?
So hopefully nominations will kick off soon for the next Herzfeld Prize, which will happen in 2026. It will still coincide with International Women's Day. Once nominations open, just think of any Jewish woman that you know that has made contributions to the field of health and give her a nomination, and they truly get such an amazing weekend full of recognition for all of the hard work that they've done.
You have been listening to the Edinburgh Jewish Cultural Centre podcast. The podcast was presented by Ella Lambert with original music by Phil Alexander. Thank you very much to Hannah Handelman, Dr. Mardge Cohen, and the entire committee of the Herzfeld Prize. If you want to sign up to the Cultural Centre's newsletter and keep up with events online and live, go to our website at www.jcc.scot.